there a risk of, have you thought through that, and what might you do?
Well, let's go back to Ebola for a moment, because it's interesting, and H1N1. If we look at the three emergencies that have resulted in, I hope, supplemental funding from Congress in the last few years, H1N1, I think people still don't understand what happened. There's a sense that we cried wolf, that said the sky was falling when it wasn't so bad. Actually, 1,500 American kids died during H1N1, way more than in an average flu season. H1N1 was a bad flu year for young people. Turned out that older people had prior immunity, so we didn't see a bad flu season for older people. But the interventions in H1N1 did make a difference. So I don't think it's easy for people to kind of sometimes stratify, if you will, what is the impact on different parts of society. With Ebola, on the one hand, it shouldn't have been as bad as it was. If we had intervened rapidly in West Africa, we could have prevented this kind of epidemic. And that's a crucial message. There's a lot of talk now about creating a public health emergency response fund like FEMA, but for public health, because FEMA doesn't cover biological disasters. The big difference is if you have an earthquake or a tornado or a hurricane, it happens, and then FEMA goes in and cleans it up. With the public health equivalent of that, we can actually stop an earthquake. So in Ebola, it shouldn't have been as bad as it was, but it could have been massively worse. I think one of the least understood things about Ebola was that we were within days of it getting completely out of control. This happened July 24th in Lagos. A patient had been diagnosed from Liberia. A cluster was starting. The doctor and nurses who cared for him were getting sick. There was nowhere to care for them. The contacts were not being traced. No facility had been found to care for individuals who were going to get sick. And the initial response was ineffectual. Then the polio eradication infrastructure and CDC staff snapped into place. The very skilled polio incident manager, deputy incident manager, came and ran the response in Lagos. We put 10 of our top CDC staff right there. We pulled in first 40, then 80 of the Nigerian doctors and other health professionals who we had trained to stop polio. And within days, they had found hundreds of contacts, done tens of thousands of home visits. In 14 days, built an Ebola treatment unit out of an abandoned old storage place, and they quickly stopped the outbreak. If that had not have happened, in my view, in all likelihood, Ebola would have spread all over Nigeria, all over Lagos, all over Nigeria, all over Africa, and might well still be spreading in Africa. And it wouldn't just be killing people from Ebola, it would shut healthcare systems. That's what we saw in West Africa. Patients won't come, and healthcare workers are scared, with reason. So it could have set back a decade or more of progress in HIV, TB, malaria, and other areas. So Ebola shouldn't have been as bad as it was, but it could have been so much worse. With Zika, again, focus on what's key here, protecting pregnant women. And some of Dr. Honein's colleagues said to me early on in this that in their 30 years of working in the birth defects field, this is the most urgent situation they've ever experienced. It's so rare you have the opportunity to prevent dozens or hundreds or thousands of birth defects. And that's what we're faced with now. So I think we have to modulate what the risk is and what the risk is to which population.
Well, speaking of that, there's a lot of discussion right now about the Olympics. And as you probably know, the WHO has an emergency committee meeting next week, and they've added this to the agenda. So CDC travel guidance would suggest that there are people who should not go. What do you think about this? I mean, should they be postponed, moved?
We don't see a public health reason to cancel, postpone, or move the Olympics. There are two issues that people raise about the Olympics. First is the risk to people going, and the second is the risk that the Olympics, because it's a global enterprise, will amplify the spread of Zika. So taking the first of those, our advice on travel is regardless of whether you're going for a wedding or a business or the Olympics. If you're pregnant, you shouldn't go. Now, if you're pregnant and you choose to go, then you really have to be as careful as possible to avoid mosquito bites, which can be very difficult. And there are some pregnant people who pregnant women who participated in the last Olympics and may decide to go. But that's the only group for which we would have specific advice that we would recommend you not go. For others, there are some important issues to be aware of if you're considering pregnancy. There are guidelines. We say wait 2 months after you get back. Wait 6 months if you had symptoms. If you have symptoms, get tested. So we see if you have Zika and you can be monitored. The other problems associated with Zika are they're not unusual problems. We see rare complications of a variety of infections. I think you have to step back and say, anytime you travel, there's risk. The leading thing that kills Americans traveling around the world is car crashes. So whether it's food poisoning or dengue or malaria, there are risks to travel. You make a decision every time you travel that the benefits are likely greater than the risks. The risks of Zika are risks to pregnant women, and that's what we have to minimize. The second issue, will this amplify Zika? Too late for that, first off. It's already all over the world. And we've looked, the number of people going to the Olympics account for less than 0.25% of all travel to Zika-affected areas. So even if the Olympics didn't exist, 99.75% plus of that risk would continue.
Do we have a question from the audience? Yes.
Hi, I'm Kathy Scott, I'm a member of the NFS Club. I want to ask you, first of all, a little about the history, because to me it just seems like you're talking about this huge power, but is this mutation, is this something that, like how did it come about? And then secondly, why doesn't a bite affect people who are not pregnant, and could that happen?
Sure. So the first question is a great one. So Dr. Peterson, no, just kidding. We actually don't know the answer to that. It may be that the virus changed. We've looked at the genetic sequence. It hasn't changed that much, but we don't understand all about the virus. Or it may be that this was happening all along in Africa, and because we don't have good monitoring systems, we never knew. Or it may be that it was so commonly spread in most places that children, girls, were infected before child rearing, and so you didn't see this. So we really don't know why we're seeing this and documenting now for the first time, but we are. And so the key is to respond effectively. Mosquitoes bite everybody. There's no preference for pregnant women, but the devastating complication is to the fetus. So that's why men whose partners are pregnant need to use a condom, and women who are pregnant need to be particularly careful.
Over here.
Emery Morseberger, a member of the Press Club. Has it been determined whether Zika can be transmitted via other animals, birds, other mammals, or is it just humans?
There are probably other animal reservoirs of Zika, but the primary vector, Aedes aegypti, likes people. So it bites people primarily. One of the reasons I take it Hawaii has had trouble with dengue is that their vector is albopictus, the tiger mosquito, and that means that there may well be animal reservoirs. In nature, if you look at other similar viruses like yellow fever, there is an urban cycle and a forest or sylvatic cycle, and that is what continues it. Lyle, do you want to add anything to that?
Yeah, the natural reservoir of this is monkeys, actually. So in the jungles of Africa, the virus circulates amongst forest-dwelling mosquitoes and monkeys. So that's the main reservoir.
Great. Do we have another question? Back there.
Would you address the possible relationship between Zika and Guillain-Barré syndrome?
Sure. We anticipate this will be proven in the near future. It's not a surprise. We see Guillain-Barré syndrome, which is a paralysis that's generally temporary after a variety of infections, most commonly foodborne infections, but also other similar infections. It appears to occur about once every 5,000 to 10,000 Zika infections based on the data we've seen so far. It tends to affect older people more than younger people, and it can be quite severe, but treatment is effective. There are medications that can be given that can hasten recovery. It has a range. It can be shorter or longer, more or less severe, but generally people do recover. Most, but not all people will recover fully, though it may take many months for that to occur. But this is not what's so unusual about Zika. We've seen Guillain-Barré with many other things. What's so unusual is the effect on the fetus.
Thank you.
What about, let me just throw one in here, what about other neurological complications? What do you?
There may well be other neurological complications, but they're going to be rare. Unfortunately, as we see many cases in Puerto Rico, we're going to see more of other things. Rare complications then get documented more frequently. But again, the priority here is to protect pregnant women. To do that, we really need to ensure that the travel advice is understood, so that pregnant women don't travel, if at all possible, to areas where Zika is spreading, that pregnant women within areas where Zika is spreading are protected to the greatest extent possible by every means we have available, and for the U.S. as a whole, that we continue to scale up diagnosis. I do want to give a shout out to how effective the team has been on diagnostics. They were able, within weeks really, of Zika being recognized as a problem, to come up with a PCR test to identify it in blood and urine within the first couple of weeks of infection. That's been approved by the Food and Drug Administration under an emergency authorization. That's now been provided to more than 100 laboratories in the U.S., nearly 100 countries all over the world. The map of the world which are now using the CDC test looks like a map of the world. And similarly, they've worked on an antibody test, an IgM test, test for infection between a few days and about 8 to 12 weeks after infection. They've also enhanced that test and gotten it approved and have it out to those same laboratories. They also have the confirmatory test, the PRNT test. It's a neutralization assay. It's quite complex. So they've been continuously innovating and enhancing. That antibody test, the IgM, they were able to fix or improve the way they make it, so they can now make it in very large quantities very safely using virus-like particles instead of the full virus. So it's a way of scaling up production. They've made 1 million tests and distributed them just in a few months. We frankly asked the private sector, your private sector, you can do this faster than us, right? And we heard back, we can do it in a year. So, I think we're okay for now. But please, we'd love the private sector to be involved because we want them to do more things. And for that last test, which is quite complex, the PRNT, they've already created a chimeric virus that merges basically the Zika and another virus so that it'll grow faster in the lab so we can get results to patients 3 or 4 days faster. And we have a couple more enhancements in train now that we hope within a few months will make the tests even faster and more accurate. But again, we do need resources to move those forward.
Right, and more available to everybody, right? Like right now, if you're a young man, say you've been to a Zika, in fact, this country where Zika is circulating, you come back here, and and your wife want to start having children, but you don't have symptoms of Zika, but you just want to be sure. Can you get a test?
Yeah, at this point, there are people who want to get tested for which it's not possible. I think the main problem is that the public health laboratories aren't on the beaten path of most clinical medicine, most doctors. So we really want the private sector to have these tests available, and we're working intensively with them to actually offer technology transfer to them to make them available.
It's definitely gone from like 0 to 100 in just a few months. So a lot of amazing work. Do we have another question right back there?
I just have a little bit of a follow-up to what you just said. Jennifer, yes, member of the club. With regards to sexual transmission of Zika, what kind of awareness level do you think there is amongst pregnant women in terms of the potential need for condom use or sexual protection during the entirety of their pregnancy? Are you worried about compliance with that? How much do women who are currently pregnant really need to worry about potentially coming into contact with the virus via sexual activity?
Thank you. So I think we have to start with the basics, which is it's really important that women who are pregnant don't travel to Zika-affected areas. For women in Zika-affected areas, we need to do everything possible to protect them and their pregnancy. For women who are pregnant and whose partners travel to a Zika-affected area, we've heard anecdotally a high level of interest and concern, but adherence to condom use is low. We know this from 35 years of work on HIV and STDs and other things. So that is a concern. We already know of at least 2 women infected sexually during pregnancy in the U.S., really before we had knowledge about sexual transmission widely available. But